Welcome to Anti-Woke and Autistic. Look at this. People with larger bodies can be as healthy, if not healthier, than people with thinner bodies. There's several things wrong with that statement. Several things wrong. First of all, people with larger bodies, why don't they just say fat people? People with thinner bodies, why don't they just say slim or slender people or straight sized people or people who are not overweight? But the bigger problem with this statement is this: it's a statement of relativity rather than absolutes. They're saying fat people can be as healthy, if not healthier, than people with thinner bodies. The truth is that a thinner person, now when I talk about thin people or a thinner person for the sake of this video, I'm referring to people who are slim, slender, trim, on the lean side, rather than emaciated or anorexic thin or malnourished thin. And larger bodies, I'm going to refer to larger bodies as obese, particularly morbidly obese or fat. So people who are fat can be as healthy, if not healthier, than people who are on the slender side, trim, slim, or straight size. So what this actually should say is people with larger bodies, people who are fat, can be not as in poor health as some people who are slim or slender, because healthy means healthy. There are very sick, slim or thinner people, very sick. They have cancer, a history of stroke, cardiovascular disease, diabetes, liver disease, kidney disease. There are people who are very sick, but they're slender. And because they're very sick, there are fat people who are healthier than them. But it should be phrased differently. It should be there are fat people who aren't as unhealthy as some thinner people. There are fat people, people in larger bodies who are not as sick or not as sickly or not as unhealthy as some people who are slimmer or slim or thinner, whatever. But to word it as people with larger bodies or fat can be as healthy, if not healthier, that is misleading. That is very misleading. Now, another flaw with this is that it's not telling you why people with thinner bodies, slimmer people, are sick or can be very ill. They can be very ill for a number of reasons. They could be very ill because they're a heavy drinker. There could be some heredity involved. It could be because they live on junk food. They may not eat a lot of junk food, which is why they're slim or not overweight. But if all they're eating is just a bunch of junk processed food, they're not going to be healthy. They could get sick and disease because of that. If they eat a lot of sugary foods with high fructose corn syrup, saturated fats, and they don't exercise and they lead a very sedentary life, these are strong risk factors or causative agents for coronary artery disease. So they can have blocked arteries. And then when you combine heredity with that, maybe it runs in the family, they could have very blocked coronary arteries. They could have chronic heart failure. They could have a very high sodium diet that causes problems. They could be a drug user, cocaine, meth. There's any number of reasons. They could be a smoker. Now that's a big one. A smoker. Smoking damages the heart or raises blood pressure. If you have high blood pressure, that causes all sorts of problems. They could damage your kidneys. So there's all sorts of reasons a slim person could be sick or in ill health or have multiple diseases and medical conditions. But those conditions are not caused by being slender. Now, being too underweight can lead to a number of health problems. But again, I'm not talking about being anorexically thin or very underweight or scary skinny. I'm just talking about somebody who has a lean look, a slender, a svelte, a slim, a trim look. The proper way to make this statement is people with larger bodies or who are fat can sometimes not be as in poor health as are some slimmer people who are sick and in poor health. It's a relativity issue. Look at it this way. Look at it as a number scale. You have a scale from 1 to 10, where 1 means you are in really bad shape. You have really serious illnesses going on, and 10 means you're as fit as a warrior. And then 5 might mean you're in okay health, there's nothing great about you, but you're not exactly in need of medical treatment either. So there could be slim people who are like a 1, a 2, or a 3, and there could be obese people who are at like a 4 or a 5. So, or a 3 or a 4, whatever. So the 3 or the 4 is better than a rating of a 1 or a 2. But if those obese people who have a rating of 4 or 5 on the health scale, they might be a 7 or an 8 if they lost 100 pounds. You see, the people who come up with these sayings, they don't think in terms of that. Again, let's look at it as a scale rating 1 to 10. 1, horrible health. 10, fantastic health. Obese person could be a 4 or a 5. A thinner person could be a 2 or a 3. So, in that way, the fat person is healthier than that slim person. But again, if that fat person lost weight in a sustainable way, no gimmicks, no unsustainable approach, but portion control, healthier food choices, and they exercised, they did strength training, aerobic training, they got better sleep, they just changed their lifestyle to a healthier way, they can bump their 4 or 5 rating up to a 6 or 7 or or even an 8. Let's see. Okay, so the caption that goes with this Instagram starts out as this: body diversity is natural and normal. If you look at crowds of people in hunter-gatherer societies, you're not going to see a whole lot of body diversity. Now, body diversity, according to this person, presumably would mean there's a lot of fat people, a lot of different levels of fat people, or the spectrum of obesity, the spectrum of being overweight is being represented. You have mid-size fat, large fat, super fat, infinite fat, super morbidly obese, just the whole gamut of diversity. Body diversity is natural. No, not in a hunter-gatherer society where they eat much less processed food than first world countries and where they are much more physically active than first and even second world countries. A hunter-gatherer society, or certain societies where they just do a lot of natural living, they do a lot of gardening, a lot of walking, a lot of just physical work, you see less body diversity. In fact, it seems that the more modern and industrialized and technologically advanced a culture is, the more body diversity there is, because you could you could literally survive by just clicking buttons all day, whereas in a more natural society or hunter gatherer or a more developing country where there's just a lot of physical activity, there's less body diversity. And that doesn't necessarily mean it's because there's famines and food shortages. It means they're just eating less processed food and they're much more physically active. So there's going to be less body diversity in a more active, nature oriented culture. Normal, what does she mean by normal? Normal, commonality does not mean normal. She continues, we need to remember that a person's body weight does not determine their worth or value. This isn't about worth or value. This is about health, longevity, long-term health. Our bodies were meant to be different sizes and shapes. We are all unique and our kids are the same. Our bodies were meant to be different sizes and shapes to an extent. To an extent. Our bodies were not meant to be fat, especially morbidly obese. Because if they were, we'd see evidence of this. We'd see the same abundance, percentage wise, of obesity and morbid obesity decades ago, generations ago, as we do today if our bodies were meant to be fat, especially morbidly obese. This is completely false. Somebody asks this question: how would you approach the obesity as a disease? Do you think it shouldn't be qualified as a disease just based on weight, or do you have a different definition of obesity that is issues other than just weight? I really struggle with the subject. That question was answered by the Instagram account holder, and she says, obesity is not a disease. First of all, she keeps preaching that body diversity, size is natural, it's normal. it's a part of the way we are, it's normal, it's natural. Yet here she is taking out the S in obesity and putting in an asterisk instead, like she's ashamed of it or she's insecure about what she preaches or she doesn't feel comfortable using the word obesity. If you think it's okay to be fat, if you think it's a part of if you think it's a part of natural diversity, that it's normal, etc., why would you put an asterisk? Why would you be afraid to type out all the letters of the word obesity? You see, there's something fishy going on here. Now, she also says there is no illness created solely by weight. There is no illness created solely by obesity. There's no illness created only by being fat. That's actually true. However, if we use her logic here, we could also say there is no illness created solely by smoking. There is no illness created solely by smoking, for instance, 2 packs of cigarettes a day. Therefore, it's okay to smoke. It's okay for your body to smoke. It's okay to be a chain smoker. It's okay to be a heavy smoker because there's no illness for which smoking is the only cause. You see how warped her reasoning is? We can also say there is no illness created solely by lack of exercise. Lack of exercise is like, according to the CDC, you can Google this and check it out, but lack of exercise is like the third leading cause of, like the third lifestyle related cause of preventable death. It's like right behind obesity and smoking. But the logic here is ridiculous. So there's no illness created solely by obesity or leading a sedentary lifestyle, heavy drinking, smoking. Therefore, all of those negative things are okay. So obesity isn't the only cause of heart disease, coronary artery disease, heart failure, blood clot, high risk of blood clots, strokes, liver disease, type 2 diabetes, kidney disease, osteoarthritis, wearing down a bone on bone, back pain, knee pain, plantar fasciitis, which is a painful foot condition, miscarriages, infertility, complications from surgery. Yeah, other factors can also cause those problems. High blood pressure, obesity also causes high blood pressure, but so do other things. Same thing with smoking. Smoking causes damage to the lungs and the heart, but so do other things. Smoking causes damage to the skin, so do other things. Just because obesity isn't the only cause or high risk for certain conditions doesn't mean obesity can be healthy or an obese person can be healthy. What warped logic? There she goes again, putting that asterisk in based off of BMI charts, which have been debunked. I'd like to see the science that debunks BMI. BMI can be misleading only to a limited extent. A person with a BMI of 27 is in the overweight range, 25, 26 to 29 is overweight. A bodybuilder or somebody who has a lot of muscle but has a low body fat percentage could actually have a BMI of 27 or 28. So for those types of people, BMI is misleading. But are you going to tell me that somebody who has a BMI of, let's say, 40, and the higher it gets, 50, is not obese? Show me one person, one human being who has a BMI of 40 who is not visibly fat and who would not have a very high body fat percentage as measured by a skin caliper or skin fold test. Show me one person, especially if their BMI is 50. I mean, this is misleading information. She's spreading false information. BMI is even more accurate in children because children cannot build muscle. So if a 9-year-old has a BMI of 27, that's overweight, clearly, because a child cannot have the muscle mass to throw off the BMI like an adult can. All right, let's see what else she says here. She continues with her answer. The bigger problem is medical stigma. People who are fat don't go to doctors as much as thin people. for fear of reprisal from medical personnel. If a doctor doesn't bring up somebody's obesity as something that needs to be worked on, corrected, mitigated, that doctor is practicing in a substandard way. That's like a doctor noticing a weird looking mole, a suspicious looking mole on your back, and they stay silent about it instead of alerting you, hey, you need to see a dermatologist. This mole doesn't look right. You need to have this biopsied. So if a doctor doesn't mention anything about somebody's weight, even if they're there for a sprained ankle or something unrelated, the doctor is not being a good doctor. They're practicing substandard medical care instead of bringing up the weight issue, and then they could refer the patient to a weight loss team, like a dietitian, maybe an exercise specialist. They could work on menus, recipes, lifestyle changes, how to integrate healthier eating. A good medical plan has a team for that. And if your doctor neglects to bring that up, that doctor is being a neglectful doctor. But get this, look at this. All right, she says, break a leg. She's giving an example here of how supposedly some doctors react. If you come in with a broken leg, break a leg, lose weight, have a cough, lose weight. Come on, that's really overdoing it. That's exaggerating. It is true, though. It is true. And I've read about cases like this where a woman comes in with symptoms and the doctor says it's because you're overweight and it turns out to be cancer. Yes, there are cases like that. There are also cases where a woman comes in with symptoms and she's not overweight, but she's told she's too young to have cancer, that particular cancer, like colon cancer, but it turns out she has colon cancer, or that she can't possibly have a certain cancer because it's a man's cancer, and it turns out she has that cancer. My mother was misdiagnosed with acid reflux disease when she complained of chest pain. They did some blood work on her that was normal in the ER, and she was told to just take some acid reflux pills. But several days later, she was back in the ER. They did a more comprehensive workup on her, and it turned out, to make a long story short, she had to have coronary bypass surgery. And she was slender, by the way. She was slender, but she was misdiagnosed. So misdiagnosis occurs rampant in the medical industry. Obese people don't have a monopoly on patients who are not treated as comprehensively as they should be, but that's beside the point. That's beside the point. This woman is spewing a lot of misinformation here. She says also she says the real issue is never discussed. They, meaning doctors, don't ask about food intake or movement. Wait a second here. If doctors ask a fat patient about food intake, and that fat patient is like into the fat acceptance thing and is overly sensitive, wouldn't that fat patient be offended by being asked about their food intake and accuse the doctor of being fatphobic? Look at this. She says they don't ask about food intake. Well, wait a second here. They're supposed to ask about food intake, but they're not supposed to mention anything about the patient's weight if they're fat. How do you separate one from the other? This person here is not coherent. They're not coherent. They're not making sense. Because if you ask about somebody's food intake and they're fat and they eat a huge amount of food, they're going to think the doctor is being fat phobic. You can't separate one from the other. Same thing with asking about movement or exercise. That patient might become offended if they're allowing themselves to be brainwashed by fat acceptance. They're going to take that question about movement as being fatphobic. Medical stigma contributes to more diseases than anybody's weight. Prove it. Prove to me. Show me the research. And I don't mean one little study of 34 people. Show me large scale studies. Show me meta analysis spanning decades that prove or show very strong evidence that medical stigma, weight bias, weight discrimination contributes to more disease than anybody's weight. Now, I'm not talking about misdiagnosis. This statement does not refer to misdiagnosis. It says disease. You show me how weight or medical stigma causes obstructive sleep apnea, stroke, blood clots, chronic heart failure, coronary artery disease, liver disease, kidney disease, type 2 diabetes, gout, reflux disease, plantar fasciitis, osteoarthritis of the knees, type 2 diabetes, infertility, miscarriage, complications during birth, and all the other things that obesity causes. You show me any kind of study, even a small study for that matter, that shows that medical stigma contributes more to those diseases, and most of those diseases are leading diseases. Also, cancers. Obesity is a fuel for about a dozen cancers. It's a major risk factor for some cancers. If you show me studies in which medical stigma contributes to more diseases than anybody's weight. Again, she is spewing misinformation, lies. Well, you know something? She might actually believe this, so technically it wouldn't be a lie. It would be a delusion. Don't believe these delusions, medical information, delusions. Well, anyways, I've said all I could say about that for this video. Have a great day.